Hey, you guys, I have a question for you. There's a bacteria that's found on 25% of women that can actually cause neonatal sepsis. Do you know what that bacteria is? Let's talk about it. So, you guys, this is Dr. T. I am the resident OBGYN on Healthy Bump Club. Today, we're going to talk about a very interesting topic, and we're going to talk about bacteria and microbes. So, do you know that the human body is covered in a multitude of bacteria of all different types that vary depending on the location or the organ or the function of the organ? One study said that the greatest diversity of microbes is actually found on the arm. Other studies may actually quote that it's the belly button. But nonetheless, there are a multitude of different locations on the body that have high bacterial count. Examples of that may include the armpit, behind the knees, and the buttocks. Sort of areas that are dark and warm, folds of the body tend to contain more bacteria. However, the gut by far definitely hosts the most amount of microbes in the body. Other organs with high bacterial count includes the skin, the mouth, lungs, and the genitalia. Today, we're going to talk about a specific bacteria called Group B Streptococcus. So, Group B Streptococcus actually lives in and on the human body. It's also known as GBS, and you'll hear me refer to it as GBS throughout this video. There's another type of bacteria known as Group A Streptococcus, not to be confused with Group B. Group A Streptococcus is more commonly known to cause sore throat. Okay, so it's a completely different bacteria. Today, we're going to focus on Group B Streptococcus bacteria, in which July actually brings awareness to this particular bacteria. So, the other thing to know, as mentioned, 1/4 of women actually carry and are colonized with this particular bacteria. Colonization just means that you carry the bacteria on your body, it's not causing any particular type of illness. Group B streptococcus is also not to be confused with sexually transmitted infection. It is not an STI. In women, the bacteria is more commonly found in the vagina and in the rectum. It's transmitted also from mom to baby during labor or when the membranes of her water bag are ruptured prior to the onset of labor. Common causes of ma- It is a common cause of major infection, including neonatal sepsis. Newborns can either develop what we consider to be early onset or late onset group B streptococcus disease. So when we talk about early onset, we're talking about the onset of infection that can happen within hours after the delivery up to a week. And when we talk about late onset, we're talking about the infections that happen a week or later after birth. So when we're talking about early onset, we're talking about disease that happens up to a week after being born, typically within hours up to 7 days. And we're talking about late onset group B streptococcus. We're talking about the infants that develop this particular disease after a week after being born up to 3 months of life. So the efforts of awareness is because this particular bacteria can cause really severe illness in a newborn. So we're focusing more our screening efforts on preventing early onset disease because this is where infants tend to develop a more severe illness, which can include inflammation of the covering of the brain or the spinal cord, known as meningitis. They can develop infection of the lungs, also known as pneumonia, or they may develop what I referred to earlier as sepsis, which is a bacterium inside the blood that's traveling throughout the body that's causing decompensation of multiple organs in some cases. So late onset is a little bit different. It tends to be a more mild disease. So it's important for moms to know that late onset may present as a lack of energy, irritability, poor feeding, high fevers. And in late onset disease, the infection is not just coming from the mom. There are other sources of the infection in infants that develop more late onset disease. They can get it from other people, not just mom. GBS also is known to cause disease in adults, especially as we increase in age, we're more likely to be affected by group B streptococcus disease. But today we're going to focus on pregnancy. And so, as mentioned, our goal is really to prevent this disease from happening as a result of vertical transmission, as a result of giving birth or breaking the water bag. As I mentioned before, the major transmission happens either during the onset of labor or when a mom breaks her water, right? And so it's important to know that even patients who are scheduled for elective C-sections should also be screened for this particular bacteria because if their C-section happens to happen after the onset of labor, or let's say they happen to break their water bag before their scheduled date, then they potentially can increase the risk of their unborn child to this particular bacteria if they're colonized with it. And so we routinely, across all pregnancies, screen moms between the gestational ages of 36 and 38 weeks. Now, keeping in mind that elective C-sections are scheduled at 39 weeks. And the way that the screening test is done is we use a vaginal rectal swab. So we take what looks like a Q-tip, a cotton tip swab, and we swab the vaginal area and we swab the rectal area as well. Now, in certain circumstances, we don't need to do a group B streptococcus screening because they're just groups of moms that have certain circumstances that significantly increase their risk for being colonized with it that we don't consider screening, or we may just empirically treat them, assuming that they may be potentially colonized. So certainly if we have a mom who early in pregnancy, she had a urine culture that came back positive for group B streptococcus, then we know that that mom is at increased risk for being colonized, because not only does she have it on her body, but it's in such a high count that it's now colonized her urine. So that's a patient that doesn't need to undergo additional screening at the end of her pregnancy. Someone who has a prior child that actually had group B streptococcus disease doesn't need to be rescreened. We just empirically treat that patient. And then certainly someone who presents with preterm labor where we don't know the status of their GBS, they may be treated. Someone who ruptured their membranes for 18 hours or more, who don't have a known status, whether or not they're positive or negative for GBS, they're empirically treated. And someone who has a known status who is in labor and develops a fever. These are just some of the circumstances that we consider just empirically treating a mom without having a screening result. And so what does the stats look like? So 900, according to the CDC, 930 babies get early onset group B streptococcus disease, whereas over 1,000 babies may get late onset group B streptococcus disease. The CDC quotes that the CDC also quotes that if we actually treat a mom, and what treatment is we give